How is gout tophi removed without harming joints? Imagine having painful, hard lumps in your joints that make moving difficult. These are gout tophi, which are deposits of uric acid crystals that build up over time in and around joints. Removing these tophi without damaging the joint structure is a careful process that combines medical treatment and sometimes surgery. The goal is to get rid of the tophi while keeping the joint healthy and functional. The first step in managing gout tophi is medical treatment to lower uric acid levels in the blood. Medications like allopurinol and febuxostat are commonly used to reduce uric acid production. When uric acid levels stay low, tophi can gradually shrink over months or years. There is also a newer medication called Pegloticase that can rapidly dissolve tophi, which can be especially helpful if the tophi are large or causing severe symptoms. This medical approach often helps avoid surgery altogether by reducing the size of the deposits. If surgery becomes necessary, it is usually because the tophi are causing significant pain, nerve compression, or joint deformity. Surgeons use techniques designed to remove the tophi while preserving as much of the healthy joint tissue as possible. One common method is called tophectomy, where the surgeon carefully excises or suctions out the deposits through small incisions. This approach aims to remove the tophi without damaging the surrounding cartilage or joint structures. In less severe cases, surgeons might perform debridement, which involves cleaning out uric acid deposits and damaged tissue to restore joint function. For some patients, minimally invasive arthroscopic surgery can be used, which involves small cameras and instruments inserted through tiny incisions. This method reduces recovery time and helps protect the joint's integrity. In cases where the joint has suffered extensive damage from long-standing tophi, more advanced procedures might be needed. Joint fusion, or arthrodesis, involves fusing the bones together to stabilize the joint and relieving pain. When joint destruction is severe, replacing the joint with a prosthetic, known as joint replacement surgery, can restore mobility and reduce discomfort. These more invasive options are usually considered only when preserving the natural joint is no longer possible. Surgery always carries some risks, such as infection, nerve injury, or delayed healing. Patients with other health issues like diabetes or poor circulation need careful evaluation before surgery. To improve outcomes, doctors often use medications beforehand to shrink the tophi, which makes surgical removal safer and more effective. After surgery, ongoing management is crucial. Maintaining low uric acid levels with medication helps prevent new tophi from forming and protects the joint from further damage. Physical therapy and rehabilitation can help restore movement and strength, ensuring the joint functions well in daily life. In summary, removing gout tophi without harming the joint involves a combination of medical therapy to reduce and shrink the deposits and precise surgical techniques to remove them carefully. When possible, minimally invasive procedures are preferred to preserve joint health. In more advanced cases, joint fusion or replacement may be necessary. Throughout this process, controlling uric acid levels remains key to preventing future problems and maintaining joint health. Always consult with a healthcare professional for personalized advice and treatment options tailored to your specific condition.